We will talk about constipation, 5 most common causes of constipation. First, let's define what is constipation. It's when bowel movement is less than 3 times a week, when mostly stool is hard, when it's difficult to pass and you have sense of incomplete evacuation. Most common cause of constipation is low dietary fiber intake. What means low dietary fibers? Dietary fibers are natural component of fruits, vegetables and nuts and whole grains, and they add bulk to stool, and they give fullness of stool, and they cause stretching of intestines and improves motility of intestine, and person defecates easily. And when there is low dietary fiber in person's nutrition, stool becomes drier and difficult to pass. Normal amount of dietary fiber is around 25 grams of dietary fiber daily for women and 38 grams for men. And almost any fruits and vegetables contains dietary fiber, also nuts and also whole grains. For example, apples or pears, or almost any common fruits and vegetables contains dietary fibers, including berries. Second most common cause of constipation is physical inactivity. Why it happens? Because during physical inactivity our metabolism slows down and intestinal movement slows down also, and stool becomes more drier and difficult to pass also. And when you exercise regularly, your metabolism increase, your intestines are stimulated, and your bowel movement improves. And exercise 30 minutes per day is advised by World Health Organization. The more is better. 30 minutes per day is minimum requirement of aerobic exercise daily. You can do also a resistance exercise and anaerobic exercise, of course. Now let's say third most common cause is medications. Medications like antidepressant, antacids, such as which contains calcium and aluminum, and iron supplements also, and calcium channel blockers also. They can cause constipation, and sometimes and in many cases it's difficult to discontinue such medications because they are important to intake. That's why at this case we need medications in some cases, such as psyllium, for example. It's most well-known laxative. It adds bulk to stool. It's type of fiber also, and it's very effective. And for long term, psyllium is safe. So you should remember that most laxatives are not safe for long term, because they can have dependency, they can damage intestinal lining, and they can have side effects. For example, they can restrict absorption of vitamins. But psyllium can be used in long term. That's why psyllium is important. For example, another example of laxative is docusate sodium, but it is softener, but it can have side effects, and it can have a dependency also. That's why it is used for short term also. Bisacodyl is another very well-known example laxative, and it's well known for people also who have eating disorders. They may intake bisacodyl to stimulate diarrhea mechanically. When they're eating a lot, they want to stimulate diarrhea, not to absorb the food, and they may drink and intake bisacodyl. But bisacodyl also has many side effects. It causes it stimulates intestinal muscles to contract, but it causes also damage of intestines, and also dependency is a problem. That's why bisacodyl is not recommended for long-term treatment. Another option is mineral oils. Mineral oils are derived from petroleum, and it coats stool and intestinal lining and improves bowel movement. But it's also used for short term because it can cause vitamin deficiency. It can interact with vitamin absorption, especially especially vitamin A, vitamin E, vitamin D, and vitamin K. They are oil soluble vitamins. That's why it's interact. Another common cause of constipation is aging. During aging, our metabolism is slows down, and it's natural process, and all above mentioned treatments are option in case of aging. And firstly and most important is physical exercise, weight loss if person has weight, and dietary fiber. But intake of dietary fiber should not be as high as in case of young ages, so it's important also. And changing habits also can cause constipation, such as traveling, for example, or your eating habits. What you eat is important also. And fifth most common cause of constipation is changing habits. And several diseases such as diabetes, hypothyroidism, Parkinson's disease, colon cancer, and other rare disease, for example multiple sclerosis, also can cause constipation, but such diseases are not common. Of course, diabetes and hypothyroidism is relatively common. Diabetes can damage intestinal nerves, and that's why it can cause constipation. During hypothyroidism we have slowed down metabolism, that's why we have constipation. And let's say another options of treatment, magnesium hydroxide or milk of magnesia is another option. And more natural and widespread method is olive oil, a tablespoon before eat in the morning. In many cases it is advised, and there are some studies which confirms that it's effective, but more studies are needed and evidences are not very strong. That's why it's not very strong recommendation, but it has some effectiveness. And in case of children, polyethylene glycol and lactulose are option because they're safety. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.